On behalf of the medical. Hi, my name is Sumanta Pal. On behalf of the Medical Oncology Association of Southern California, I'm thrilled to be announcing our Researcher of the Month, Dr. Gottfried Konecny. I'm based at City of Hope, but I actually started my training at UCLA. Dr. Konecny and I go way, way back. He was a fellow, if I recall correctly, at the time that I was doing my medical school training at UCLA, and he's gone on to do great things in the world of gynecologic oncology. Gottfried, congratulations.
Thank you very, very much. Yes, we go back a while. We had the same mentors at UCLA, so it's a pleasure to be speaking with you today.
Thanks so much. Well, just a couple of questions for you. The first is, tell us about an area of research that you're participating in that you're particularly excited about nowadays.
Yeah, so I focus on women's cancers, so really medical gynecologic oncology, and particularly drug development. Again, this has been an area that has seen very little progress over the last 20 years, but in the last 2-3 years, there's been a dramatic improvement in treatment options, understanding the molecular heterogeneity of the diseases such as ovarian, endometrial, and cervical cancer, which really has led to innovative approaches and new clinical trials for patients suffering with ovarian, endometrial, or cervical cancer.
It's amazing to see progress in those fields, as I certainly remember how dismal outcomes were when I was in training. Can you tell us about a trial that you're excited about in this space that perhaps our MOASC viewership should know about?
Well, I think a major progress can be made in developing novel antibody drug conjugates. And you're well aware of the concept of that, identifying a protein that's very selective for the cancer that is not expressed on normal healthy cells and will allow a safe and effective treatment of a payload that you couldn't give without being linked to the antibody. And we have a drug development program where we're looking and trying to identify novel targets that are unique to ovarian or endometrial or cervical cancer. We have identified very novel, unique targets that have not yet been pursued. We've developed growth inhibitory monoclonal antibodies. We've developed an antibody drug conjugate that has gone through clinical development and is now in phase 1, first in human clinical trials, which is showing very promising activity, even at such an early stage of development. It's targeting the protein called Claudin-6. Again, the Claudins have drawn a lot of attention in oncology, 18.2 recently in the GI world. This is a unique target, a very effective and very, very safe and well-tolerated payload, very much in line with the recently approved folate receptor targeting drug, mirvetuximab, which is the first antibody drug conjugate to be approved in ovarian cancer. The nice thing is that both targets are mutually exclusive. So I think we're targeting a different patient population, but this is a great example of how we can improve outcomes in ovarian cancer simply by introducing novel antibody drug conjugates.
That's fascinating. I personally am starting to hear a lot more about the targets you'd mentioned, Claudin 18.2, Claudin 6. I saw the CAR T data in gastric, which really looks just so striking. So really excited to see what you're going to be doing in the gynecologic oncology space, Gottfried, and such a pleasure to reconnect again. Congrats on this achievement.
Thank you.